Hi, I'm Dr. Devayani Barve. I'm a plastic and cosmetic surgeon and I practice in Mumbai. In a prior video, I spoke about the before surgery mistakes which we commonly see. In this video, I'm going to elaborate on what mistakes can happen after surgery. Even though we discuss about things to avoid after surgery, it is human to forget some of them. But these are the ones you should not forget. Point number one, most of the surgeries in the recovery period, you will need to wear a compression garment. A compression garment is going to be your best friend after liposuction, after a tummy tuck, after body lifts, and even after breast reduction. It is very important that the garment is comfortable and snug fitting. Every time the garment loosens means that you have shrunk and your swelling has gone down. The garment needs to be periodically tightened, and I have had patients go from an XL to an L to a medium size over a period of 6 weeks. So if you get your garment altered in time and if you wear it diligently, I guarantee you will get the best result from your surgeries. Point number two, using an incorrect posture for recovering after a particular surgery. So if you've had a breast surgery done, for the first 7 to 10 days, I instruct the patients to sleep in a straight supine position. They can turn a little on the side with a couple of pillows, but I do not want them to sleep completely in the sideways position and definitely not on the chest. Same goes for a tummy tuck. For the first 7 to 10 days, I want patients to lie down straight while sleeping. They can turn a little on their side just to ease their back using a couple of pillows. But a complete sideways sleeping position or sleeping on the tummy is not recommended. For a body lift, upper or lower body lift, again, the instructions stay the same. For a liposuction procedure, however, I want the patients to turn in bed and I want them to shift around because we want the swelling from all sides to go away. So the position you adopt after surgery is not fixed for a liposuction. In case of a buttock enhancement surgery, however, the position requirements are the most stringent. You will not be allowed to sit for a long time or lie on your back for a long time. When sleeping, you need to be sleeping in the prone position, that is on your chest, for the first 2 weeks completely. After that, you may be allowed to turn on your sides a little bit, but you are still not supposed to sleep on your back. The reason for this is when fat has been injected into the buttocks or an implant has been placed, we don't want any direct pressure on that area which can affect the healing. So it's always important to check with your surgeon what postures are recommended for your specific surgery. Point number 3 is about massages after liposuction. Swelling, fibrosis, and unevenness over the skin can worsen if massages are not started after liposuction. However, starting the massages too early can be a little dangerous, as is postponing the massages for a long time. So usually I recommend that massages after liposuction should be started about 7 to 10 days after the liposuction procedure is complete. The reason for this is that the skin gets enough time to recover, the bruises are almost settling down, and the soreness has reduced so that the massages are not too painful for you. Some of these massages can be uncomfortable, and that's why we recommend moisturizing well along with the massage. A lymphatic massage is what is suggested after liposuction, but it is something you can do on your own. You can refer to some of my other videos on lymphatic massages after liposuction. These massages are to be continued for about 2 to 3 weeks till the treated area softens and the unevenness which may be there after liposuction settles down. Point number 4 is resuming workouts too soon after surgery. Any surgery takes a toll on your body, whether it is liposuction or whether it is a body lift. For liposuction, we recommend that after 7 to 10 days of surgery, you can resume most workouts. Walking can be started for all surgeries immediately after. However, it should be gentle, gradual, and not something which strains your incisions. For a tummy tuck also, after 4 to 5 days, you can resume regular walking. However, for most surgeries, after 4 to 6 weeks, you can resume going to the gym, lifting weights, and doing high impact exercises. Remember, after a breast surgery, it is very important to wear a good sports bra or a compression garment while doing any kind of exercise because we want to give good support to the breast. Also, after body surgeries or liposuction, it is mandatory to wear the pressure garment while working out for at least 2 to 3 months. This will help you get the maximum shrinkage and achieve the best contour possible. Point number 5 is do not panic after your surgery for any unusual things which you may see. Bruising, swelling, some amount of discharge on the dressing, all these things are normal. If you feel anything is of concern and it is natural that you may get worried, please reach out to us and we'll help you with the same. Do not get scared, do not panic, and do not think that your surgery has gone wrong. Everyone's body and everyone's healing and recovery periods are different, and everyone will recover in a different way. So let us help you get through it, and do not get worried or worked up if something seems unusual.